one more chance. So would do no rather come home, na for make a na fe nyame ina awie mudi a akase Kristo una waye e was said that waye on for am yes so pa say better polity na fe nyame ina ndumum iwie a akase asedan ka wodi wo Kristo e da wase ye hia something de wanim ubrepem yi wa hye ho anim yam na wo mba ya fa asedan ma wo Jesus dimonti amen. Yo ejeje for said the medical kana and the 3rd of April. When you made a chair, and medical catch him, and as the camera, they say Yonkodoradio was so, and the CB radio was a Sarah. And it in your main area will be a person said, Tia Sebi for Frono, which my call YouTube after work with you. You knew about Berenda Asante, and an age you may de obedi and him. Was over can stroke, was some, the moon seven no. And from Mama Yina Fiaso, and Bear and Fenno. We are as a Musa and him will be or be answer at the Abba. I show you a minimum. Mamma Belinda Santi, Penny Jaham, Mema, yes, sir, where the Adams and come and show them an argument. Amen.
Amen. That's it. See, Pachaman, try me to share my screen now.
No problem.
In United Team.
Yeah,
okay, good. And that's it. And topic and per se di ho and common stroke, carotid artery disease. Tiabehe relationship or more management in terms of treatment options. And I said signs and symptoms as I say you pay attention to. Overall, no risk factor being a myanya stroke, and I said carotid artery disease, Ninya you be over. And my such picture to be a bema me explaining abema yenya tiasie. And to say we representation I saw what questions to be up. And I said BB chill Adrian Patrotron and down to you and at the home come. And to wait na mekan where your objectives are and you be seen. And he said ya kase obianya stroke and person so because of what is stroke, what does it mean? Basically, BBI it happened all of a sudden. Blood supply not a deco brain, no matter oxygen, I say food, and I say nutrients of brain, BBI disrupted that blood flow to the area of the brain. Into so being a stroke up and not stop muscle, and I say tissues of the brain, I damage. Into not that signs and symptoms, it really depends on baby a blockage in the wall. I think there were two different types of stroke. There were ischemic stroke, and only when a blood vessel, and I said blood supply to that area, and I block it, and I said, "Baby, I find a plaque." Plaque, and I said, "Oh, high cholesterol, and I said fatty substance, and I said calcium. Then I build it up. It was blood vessel, and I mean blood into me and quote. Straight to brain and into that blockage now and then that and my stroke now and I said will be on your blood clots or baby a blood vessel in the wall into blood again blood and into me and brain and my and yamana is still here to function on a daily basis. The one near hemorrhagic stroke and I say because it will be bleeding on the brain one. It just means that vessel not a dead blood in the core your brain and BB one or BB causing I burst into a blood in the edge just perfusing in your brain and a brain into your BB a very close compartment into the BB could be a happen to brain now ubenya signs and symptoms and I say effecting that you ubenya stroke now. Unfortunately, a couple of years ago, not stroke yet, the 5th leading cause of death in Americans say is the 4th leading cause of death. Let me say, yet to help us to prevent stroke, and majority of Americans, the ischemic stroke, the plaque, and I said blood clots, that's the majority of the stroke now. I say one thing I'm your dream sister says stroke, it's 80% of stroke is preventable. That means a given a year, but you found home, Sani and Sian and the day. And but at the end of the day, you found home, so I know we don't get into this problem at you being a stroke. Some of the risk factors of stroke. A never been a team you're putting at risk for stroke. And never half of somewhere never way muno, it be a high in team change and it's a age. But stroke the idea of team see at any age and crow's opinion. But so we drew after age 55, or risk for stroke a double. Into drew age 55 and then you're betting ya fa yen get to stroke. Also, so sex plays a role in stroke as a risk factor. Emma is a greatest risk for stroke. And it's because your hormones and in it, a lot of things play into why Emma and stroke more than Emma. And a race, unfortunately, Black people saying have a greater risk of stroke than Blacks and Hispanic than a white race. Another thing I see was high blood pressure. Unfortunately, high blood pressure, I said, high blood pressure with stroke because that's one of the things that a bit to me, prevent it from getting stroke. See, a bit your DDM1, and I said lifestyle changes, and I see a bit for your medications. Now, I know said the tory and perceive a bit for medications. You just said herbals and but blood pressure, you to me control or risk for stroke a decrease tremendously. Often, so a family history of stroke, and I said what. Family history of transient ischemic attack. I know your stroke now, you're temporary, your symptoms over 24 hours in a SAS, which symptoms I are resolved. Not just said, still to me function on a normal basis. It means that when you're stroke and lasted longer, which is good. And I saw MI or myocardial infarction, that's heart attack. And it's important to see about your family history. So I told you your name, say your mom side or say your papa side will be a family history of stroke and I said heart attack. And you could say you better dig it deeper and who your family history and tonight when who say, okay, I'm at risk for stroke and then I'll be to me with me decrease the risk of stroke. And I said what atrial fibrillation and only I said heart rhythm irregular. It doesn't beat as normal as it should and also put you at risk for stroke. Or you'll be a smoker and I saw a high cholesterol, diabetes, obesity. You'll be and I said we're taking in a lot of alcohol. And I said kidneys and then your injury be your factors. And I said risk factors that you're putting in at risk for stroke. Some who pictures, you know, some pictures in the channel, Obi explain ya to me say you can't carotid artery disease artery example of how a blood in it is supply artery supply blood to the rest of your brain into we had the hello so her far right hand side in that when said your friend saying the disease artery and I said baby your friend said whole ness I say normal for blood in it to me flow through we had the top one now I yellow and on your friend a plaque until we had blood flow now as I said a quote brain as I say very narrow into blood and into me quote brain as much as it needs to help perfuse the brain and I said to help the brain a bit function on a normal basis and then they put you at risk for stroke and I said so when your blood clots it will happen until we press our picture now it's a BBI yellow and no enya de papa into plaque and so like me kind say what cholesterol high cholesterol and I said fatty substance and I don't know say and say no and that calcium meaning now build it up it causes that blockage in your artery it's our artery now where your neck and then your friend a carotid artery disease see who saw blockage and that depending of how narrow it is near friend say maybe 50% of the disease, carotid artery stenosis. And I said, idea to say, baby, fahon, and son, I said, block it completely. And I just said, right now, no need blood supply to your brain. And then your friend a stroke, and I said, brain attack. you know. Into pictures ne me did share what I saying just to show how are your arteries, you know, and that's a blood supply to you from your neck and your brain, and how it all works together to help perfuse the brain. Into another thing is a carotid artery disease, and it is approximately 20 to 30%. It causes stroke. So unfortunately, the hospital is said by the time I will be who saw sad disease and not just when you stroke, and that's when you that temporary stroke, you know. Until yes, I not one of the doctors in because ultrasound neck and say what carotid artery disease that majority of people are more stroke, and yes will have about symptomatic about 70% of the artery, you know, are narrow stenosed. And necessarily you be for home. And that's the big major relation between stroke and a carotid artery disease. So depending on how severe na or neck artery no, I stenosed and that's very narrow no, it just puts you at a greater risk of getting stroke. And then also like the plaque, you know, again, will cause you to have that temporary or transient ischemic attack or stroke. Basically, you don't have enough blood flow to your brain, and you're friend of hypoperfusion, and your brain is not getting what it needs to function on a normal basis. In terms of plaque, you know, and a picture I'm the show saying, it's very nasty, and yet baby papa, because we hear and never will a blood vessel anymore. A better than that blood in the team brain. You just say the baby found home to me in a free home and sana what to me and your good blood flow to your brain. And depending on the type of plaque I want, you're different. Your ultrasound now, your ultrasound technicians, no matter what type of plaque it is. Depending on there's 3 different types. Depending on different types of plaque, to me, who's at risk of ischemic stroke, and I said your risk of hemorrhagic stroke here, and I said, depending on stop plaque now on the one, so we need symptom cry. I say you be found, and I say do cause surgery. Need to me when you found a free one. And signs and symptoms, I think said that's one of the most important things. As I said, you pay attention to for stroke, you know. I think saying because the acronym FASTA, Ubinya stroke, I will share the facial expressions. Facial muscles need to be so weak set. Your afraid be facial droop, not just say one side of your face, you know, because muscle near weak, you know, I drop up or smiley and then necessarily changing. Another one, they say Ubinya arm weakness. Wow, to her now has said. Lift your arm up, or lift your ass down. And that's a sign that so pay attention to for stroke, arm weakness. And I said, if it be slurred speech, or kasa saying ya kasa say and that all of a sudden will kasa change, and I say yes, and I saw what kasa crowd will be tiasie. And only a be so as I said, prompt you say, the dear neck console. And I said, I know kasa say, and that's one no beautiful phone, so then kasa all of a sudden. Because I change, it's very important that we team fret. So we need to change our friend name animal. That's our friend 911 immediately. And another thing is time. The entire I know sometimes you have symptoms and I say be high, I say, me okay. But stroke the idea time, no, it's very important because of time you be who so your normal for or your normal, you can say time of your normal function or neurologic function, meaning the time I will be who say we are okay. No need determine your friends a treatment plan I did amount. It's the time window is like 3 to 4 hours. And it's very important. So when you say slurred speech and I say facial droop, so we'll catch you and I saw friend 911 immediately. Another thing that as I say pay attention to in terms of science, and they say be loss of vision. And it's just temporarily. It's just a cause it like maybe a seconds or a minutes. And I said, when you're like one side of your vision, when you're blindness, and I said it's blurry. Usually a minus or more symptoms in it, and yet, you know, different from the norm. The norm is when your facial droop in it. But in my symptoms near different. It beauty when your loss of vision for just one side. And I saw moon who be and I saw foggy. You know, signs of stroke, and I see pay attention to no. And at this artery and a slurred speech, you know, and I say slow speech, and I make kind of it being so all of a sudden we all have a difficulty swallowing, and only a friend of dysphagia. Aphasia, something that so when you're like it has a full blown stroke. Untimi kran kasa affected how I'll be to me a kasa we so untimi kasa bi mu kasa kran na so person kasa obi nti ase kra and there kind of weakness any menoparesis so one side of your body it gets weak than the other side, and I say unfortunately be one side untimi moving the kra and they say friend of partial paralysis that's just it. There's nothing you can do to move one side of your body at all. Hypoperfusion, so the bright light amaurosis, and only and also so like can you call a vision just by being in the bright light. It be mutiminya lightheadedness, and I said dizziness, and I saw more sorry, not all of a sudden or muntimi engineer. Meaning signs and symptoms of stroke, I say you pay attention to. And I say so one will be at 1 hour kasana, so be catch us and you are me feeling like this and that now. I say who say okay, dear, okay, if you a stroke, and I said it's important to over friend 911 right away. I don't want us to ignore the signs and symptoms because I say you and tema are preventing you from having a long-term effect of stroke signs and symptoms, and I say to me what keep them now. And then in terms of diagnosis, then I'm person who said they kind of said, unfortunately, by the time I've been working, by the time you've been home and qualified by your hall for ultrasound study, not a stroke already, and not so many of that temporary stroke. And based on that, more primary care say, oh, because so vascular surgeon. No, or carotid artery disease. Some of the diagnoses I team for stroke, and they say CAT scan. And I say MRI, which that picture on the far right, the one that yellow now, and only a CAT scan, and the arrow in the pointing it is showing how narrow, because I said a vein or neck, how narrow it is into. So, opposite blood in it flow to brain into me because I block it. And then I pay attention to, so you pay attention to how narrow your vessels are. And another picture in the middle is the contrast. And it shows that the part of arteries now are very narrow and we need to do something about it. And then the last picture on the far left, a ultrasound or more your technician or more measure the flow, how blood and flow through vessels, how thick the blood is, to give us a percentage set into how bad is the artery. I stenosis and nasa kitweb, and for instance, the majority of carotid artery disease, and we use the ultrasound. Your ultrasound will neck blood vessels, to figure out how diseased your arteries are. And how do we determine what the best clinical management is? And as a DNA team, what is our goal? So you can be in your carotid artery disease, and I said will be a risk of getting a stroke. How do we determine that? And only you're looking at age overall. No, your hair so heart you're healthy, and I say you're healthy. Your hair baby a different thing. Baby a narrowing of, and I said baby our blood vessel no I get one. You're hitting and your hair lesion to make the best decision. Say is it baby a bit timid a medication a treat, and I said baby as I said you're in a surgery. Let's see. Some of the medical treatment to help reduce your risk of stroke, and then so majority of people when you're stroke and you put you on aspirin. Why aspirin? Aspirin, a drobia, your friends, it's basically a stopping cells, in the blood from shrinking. Cells in it, a blood in and I said it causes blood needs to stick together to form a clots. So aspirin to me it help him manage so then it doesn't form a clots to block your arteries. Until a drobia power so risk of stroke and that's a majority of obia when over 55 years and above primary care is sometimes will put you on aspirin. It's just to help reduce your risk of getting stroke. Another medication I did, Emano, it's a medication friend is statins. It's a lipid management. It's for cholesterol, high blood cholesterol. You who say well lab work near who say cholesterol up near your friend statin and that's a Lipitor amount just to stabilize that plaque and they're not a yellow being a blocker or arteries, it's to stabilize it. So I and get too bigger. And I said, it's me, sorry, it's me and get too bigger and block arteries to your brain. So not blood flow, it's me flow properly. And also, in terms of the lipid management, we will be able to smoke. I catch us at jai smoking because I know it constricts your vessels. And I said, smoking quite jai completely. I know some conformers looking at doing some big jai. Again, the biggest thing I'll be to prevent yourself from getting stroke and blood pressure management. And I said blood pressure control. We'll be high blood pressure. And I said, we are close to getting high blood pressure. And so who said, what your lifestyle changes be? Reduce or risk of getting even that high blood pressure and I said putting you at risk for stroke. So between I 15 to 30 minutes a day and I say a DDM I say so one of the most important diets and so for low sodium and I say low salt diet. Now we'll do plenty of fruits and vegetables and I say I hear DDM. Another thing is diabetes. Diabetes disease be a enya cry and into a put to a risk for stroke. And to do it I found it says will be blood glucose count it needs to be less than 7. That's your goal. Yes, so now to me decrease your blood glucose count. So more than now to me another thing is alcohol consumptions and I will drink it too much as a so jai. And also wow. Let's see. In terms of surgical interventions, unfortunately, again, any medical treatment, is an option for. So we will be at doctor you're concerned about. So when your carotid artery disease, if you need signs and symptoms, and I say when you stroke. But until so open where now unya stroke and that's unya symptoms of stroke now your ultrasound and near who so stenosis and that's a narrow and 70 to 99%. Unfortunately, I see surgery. It's me plaque and in free hole and that's a blood clots in your see free hole. Now when to me ankunya stroke. The whole point is to prevent you from getting stroke. But unfortunately, so you'll be when your stroke symptoms, we still ultrasound and now we at 50% of your 50% or greater of your arteries is stenosis now, then we'll take you to surgery. The preferred surgery a carotid endarterectomy. And when a picture and I'm the middle and I said both pictures and basically I'm more in more exposed to neck normal core artery name. No, may you saw plaque yellow stuff in your nerve free move. Or we are normal patch, yes, suture it together. Just so you can have better blood flow to your brain. Another thing, so obia so obana said we need issues with stroke and I said when your symptoms and I said when your stroke but stenosis near less than 50. what we do is we watch you closely. You bet you do about usually depending on symptoms, you do about 6 months, you do about a year, and you to me follow more very closely. And I see your patients now more carotid artery disease, because I say a idea is you pay attention to not and you're too big. Say, oh, well, vessels near narrow. It doesn't mean set over years, and it doesn't mean set increasing over the years and increasing. So a year increase now, yes, 70 to 99% now. Then, unfortunately, I see it take you to surgery. It's free or another type of surgery. Carotid stenting, and only at least invasive. And the stent. As I said, the picture is shown. The stent to open blood vessel, just to help put more blood flow to your brain. Majority of women intimate already your friend is saying carotid endarterectomy, you're taking all of that into account. Will be a intimate tolerating invasive surgery, stenting in that another type of surgery. Say abaso, and it's fairly new. It's basically combining the two surgeries, Still your best suppose your neck and then near the stent in Ashahol, just to help put better blood flow to your brain. And also your least invasive set. And no route to not percent or quiet. Again, we are patient and also we will be at what this disease are. You have the choice to decide what type of surgery or percent we are. With surgeons and about working together, they'll give you their professional opinion in terms of which one will be best for you. But at the end of the day, you have the right to, do more digging or seek second opinion. One thing I'm person share for you, I said, don't ever be afraid. Said, well, Dr. Kabi be extra while be seeking second opinion. It is in your right. So Beher said, you're all kind of your corrector. And I said, you're kind of in your so no be for kaka safa home. And sana waka yes. And all of this, the take home point I'm passing and I said, stroke here at DBA, it's very preventable. 80% that's a huge number. It's BBA you bet me BBA home. And he said, oh, fear na so mobile or benya stroke and as signs and symptoms. And again, the most important thing is to be said ne kasa change and I said or cerebral na as in the facial droop, the serial change ya. Or because my arms are weak than the other arm. And I said blindness and the signs and symptoms that you're causing yana. It's important to open to catch them so I'm on friend 911 immediately. And I said so stroke the next day uncle who the primary care, just to seek clinical treatment because a BBA and I said risk factors, we had a BBA lifestyle changes and it's always number one approach. So lifestyle changes and not one put to a risk at getting stroke. And I said, and don't be scared to talk to your doctors or call or primary care visitor. Your next visit was almost on your detailed assessment. Sometimes a primary care and the team listen or the stethoscope and they listen to your arteries now. But to me, TA sound to be a friend of brewery, which is basically it's irregular, pulsating sound. And no to me alert you. I'm say, oh, okay, maybe I have carotid artery disease and to vascular surgeon and to or next visit tonight. Sometimes it be more a thorough assessment, but as I one I will pokey for primary care no more there's some more now who said, okay, at least this year require and BBI okay. And I also make sure saying you fire medications as prescribed. And another thing is in person it says that medical people be sorry and I said nurses and I said doctors be sorry don't be scared to talk to them and I say seek advice and counsel depending on medical issues or more. We are here to help. But now it gets you too later. It's by the time I will catch you be now too later. You to me my advice I won't hear. To see the right people in team patrol some more medical people who are how we're trusting that, just start talking to them right away. And also, again, healthy eating and lifestyle changes, less salt. I know say salt in the money there, but I say less salt, and I say walk here, and I said some type of physical exercise 3 times a day be to me boy and tea. And when I'm person share with the whole church, that's it. And thank you guys for your time.
Yeah, that was it. Mama Belinda, I'm sure so I'm a corner rather falso. And this the same way I and I said, so this I'm sure be pray. I did it for you, but Naluesi. A beno so be was in Busa and I some baby was some account with a family one. A Pamacho, obeying the Abana funeral additional every mode. Madam Massey. Your brother was your full Busa drinking the Omnibus. My mammy saw a question back with the kind. Maybe a toss minute. Now, would you walk us some more can be far? One patch.
Hello.
Patch okay, be far. Say, so would the infibia say 55 years corner? You says sex with as I said, in all when the open so chance it be a bit question will stop. Now, so yeah, at the same be seen you who said, Sabe quality be a moment by here. And it's how do you explain it, Pacho?
Oh, Pacho, what's it say? Democrat says 55 years and above now. And as I said, it be a we was sex when I did it. Meaning, so person do what? Yes, top of cry, yeah, 15 as I said. No, me sex and not me Pacho said male and female. Sorry, and he said if one person chest said we are oba. We are at greater risk of getting stroke than Bema. And now we can't say risk factor for sex now. That's what they mean.
Okay,
yes, just like your sexual orientation. So you're oba, we are greater risk for getting stroke than Bema. Gotcha.
And the second question here, the old surgical interventions, no. Which is some picture be and some funny picture ya who pay. Baby no the etchen say and I said the who say you see ya more years said you man added na it be a choose number no sometimes no it be a we fit be a mudia bit to monada na problem aba but I discovered the home ya no crack and I say no crack.
Yeah, I know crack sometimes it to me see but we say a medical community not taking a very close look at that until your steps or surgery why you're not just there with the doctor, nurses, or anesthesia until there's a whole group of people on more counted and near my you see and as I said you're counting many who said you really send near sooner so you saw 10 devices we are surgery now, so making sure set 10 devices now you see and one chain I between you throw away. Say until more thorough in terms of that in accounting. So more counting I said more scan on your between like imaging and I said like x-ray and I said CAT scan immediately to her baby Sanya man say maybe you refi now mujai no body no ma scan no betimi ama ye hu say okay ebia wa ha sente so mu call back ekoyi ni nyina but ye bibia etimi si but say basi there I think that at this point surgeons not pay very close look at it and we don't see that as much.
Yo medawasi ebia me de besia na abusuafo aka so obi was embesi bia ode aba ejele for me sama so bi was embesi bia obetim da aba na fi no me third question o na me da aba actually medamasi
yo me pacho kamis mi misa ba ku bi enfe
bra pacho bra
yo pedasifa mse na o kase uhwemu a nifa se bi esu etie no kra no etimi eba se ye no kra in advance titru ne atutum fo me to bi so a yembisa yebusuam na se yehwehwe se ebi ewo ho ana se bi ni ho a na chese yafe ho adi ana se ebi ni ho kra no wo na obetuma ye fresh person na obetuma ye pie na se etisa enie na edie na so wo bio na wo ni bio na o ka se yehwe edie ya na se yehwe ho yie bi no enuani ana se yenye den die ni yenie Ghana ye dokono ne ye shito ne no ni yedi e basa no idea na yenyo die na yenie ka ebiti aboa ama yenkunya kra se ebi wo yebusu ma na se wo na be first person na emfa also emma.
Amen.
Yeah, that unfortunately the all kind of ebi mutiminya all of a sudden ebi omuni risk factors and I said omuni family history crowd, y'all can be to me. I be the first person that be to me and yasa stroke now. It's crazy because this past week in a patient to be at not only family history be or you're very young in the 30s, no, yet the first time to get stroke. Or you perceive who's in here, it didn't tina or timinya stroke, but it can happen spontaneously at any age. And today, pete the obetimi aya fa ho ne ne de kind of DDM DDM no. I know say you pay a doctor you pay full, but at a certain point, you know, so butimi busa ho senti adwanina media. I mean everything in moderation. Adwanina media at this time na be boa me. Oh, and tina because say even if say you DDM no say you use salt a lot and I say sodium ne a lot and I say a decrease, you know. Ye adwane say the keto bi na ye nti de betimi aboan pa ne lifestyle changing and say ye didi mu no and I say you making sure say you physically fit and say you be exercise kakra say obetimi walk it 3 to 4 days a week na so oboa ho na timi walk it kakra na ebeboa because what happened is a didi mu especially for us Africans, you know. I think say cholesterol no yet a big deal because you eat a lot of meat. Oh, in Tininya, it's cholesterol, a lot of fatty substance. And in Tininya, what you're doing is you're putting your risk at blocking that artery, no. Into diabetes, boy, we need family history. The most important thing in it, your activities now and another thing is your annual checkup, you know. I say you pay attention to your blood pressure, and just because say your blood pressure, any blood pressure issue, maybe this year, and I said the past couple of years, and it doesn't mean saying to me, so because I go to blood pressure machine, well, CVS, and I said Walmart to probably to me to be no to me monitor our pressure. The goal is sell them out blood pressure now you're low, because that's one of the biggest risk of stroke. And I said stress, and we need blood pressure. Can I get stressed and that? Or you're stressed out, your body is reacting to that until pressure record high, even though you don't have high blood pressure until your BBS is you pay attention to. That's it.
Okay. Yo, open the aba, Pacho Fabra.
Pacho, now Kabi say, do stage binase, unya. Bibisa na anase to other boys or nurse or service maybe be more. And you put will be a community request patients maybe on aspirin. I make us say I advance I will say then my if you quite me. Advance I will say the best I said that aspirin be anonymous. Daily and now weekly basis and yes, yeah, no.
Aspirin, no. It depends on age, you know. Aspirin, like I said, 55 and above, you know. Yes, ubetimia for aspirin daily.
Without doctor,
no, but the most the most important. I saw no primary care in casa. Someone who age put you a risk, a stroke, and you put you at risk for. To say 55 or no and above, no, now risk for stroke and a double. And I say, okay, now primary care and say if I want to aspirin be as well. I said this is the time I'll be to me abusa almost say, okay, what's your BBF stroke? And I said carotid artery disease and all now. Okay, so no a casa her said, is it a good thing so be to me I take aspirin no? And so who drove be I will take it in general.
All right. Especially say Enma if you can the moon sense will be an preacher, maybe all the advice club will be how the crowd over say what take problem no because you are more and 7 on 6 no very different na obi was age no na o ka chen say oh so there obi o ka was some meeting wants to be a sign of this go over the counter na to have aspirin na regulating no without doctor's prescription. Is it bad?
It's unofficially, it's not bad, but set me, medical provider, and send me my advice, I know say, yeah, and you're maybe into doctors and that's a but, and yeah, a aspirin, so yeah, a drobia as a risk of bleeding at something so yeah important, say you be who and son a wafa. Internet a drobia or before because oh I say who doctor and son yamo I take his no. But say will be a yeah check your labs now when you risk or bleeding risk and a lower I'll bet him yafa into the answer now with him the amount of and because me person make us say yes now kofana say who say bleeding risk and now because we bet me bleeding with aspirin. It's good to bet to me no be obey to me alcohol doctor be and then akasa and sana what take some medication no.
But you're bleeding with aspirin and I ain't found a name bleeding at how bleeding to be a whole beginning to be a me quack me bleeding fine. No, Mama, we bleed the fine. Risk of bleeding, I mean to me.
Bleeding, it be a different size. So, or you bruise you very easily. Or be how or take certain medication and channel who said the skin will blue or bruise you, and I said blood be a bit top skin no who superficially. And I said, BB, as I would do when I bought a diner and while bruise, So we will be risk for stroke, or bleeding risk and I'll be with me on the side. And I says because use the bathroom have a bowel movement when say not color that change it. Into no you be out so pay attention to into the color need change because okay I didn't know say dark and as I said coffee ground type of color no. Let's just say yes. And I asked for now we're taking it, so thank you. It's there were 2 different dosages. There were 81 milligram aspirin. There were 325, which is full dose aspirin. Aspirin now you did my stroke patient 81 milligram there no.
Like I said, a higher dose
no, a lower dose, low dose
lower
aspirin.
Dose.
Yes,
Okay,
81 a day. Yes.
Okay. That's about
And there was opening more Pacho.
Baby, I'll do ye. A Jamisro, Mammy be some back up and
okay, Coso.
And he said, said you see Chimu, you want a dosage no be brave, okay. Mati say, Omoka junior aspirin, and no okay, and I say a leaf no day a mubiano, and I say
no aspirin. I leave when it's a different medication group. Until I saw who bought on it aspirin, and yes, Omoka junior aspirin is baby dose aspirin, and no that dose in 81 milligrams. It's so we son what was our pill no.
And you say be a tea pie one. I say, yes, you walk to aspirin where you be known a leaf prana, a no be na walking, name aspirin, and then also near friend junior aspirin.
But a leave no your friend medication group and NSAIDs, so and no for pain relief and then but baby aspirin, no, it's in the group of your friend antiplatelets. Oh, it's confusing because Nina will almost different group a year Juma. Oh, say like, oh, a headache, and I said, BB, like, oh, pain, and yeah, leave now, and yeah, aspirin, I'll be fat, because that's not aspirin's job. So, a bit, and a bit more, a bit bow for pain. So, let's say, oh, body cramps, and I said, muscle aches, now, maybe I'll be fat, a leave, and I said, Tylenol, and I said, ibuprofen.
How about baby aspirin?
Baby aspirin, because I know need your friend say antiplatelets, and they're not making one presentation.
Say you're good.
Yes, and then your friend. Yes, so baby aspirin with the Google group name. Baby aspirin, 81 milligram dose.
But and yet junior, name of a baby.
No, yes. I think it's Ghana for friend junior. How it has a friend baby aspirin. I think so Ghana for Becca junior aspirin. And no, but the most important thing yes, but the most important thing about that is I said we pay attention to a dose, milligram now. I said, oh, hold on, I took everyone. Hold on.
Yes, it's the same.
It is the same.
Yeah.
But because junior aspirin, baby, American baby aspirin, I say you're confusing, but it's the same. Until so, we'll take care of drug. Person who said the most important thing I will pay attention to a number media group 81 mil. I can't will bottle on a home. It will tell you baby aspirin 81 milligram.
81 milligram. Now for back.
Yes, dairy.
Yes, one a day.
Yeah.
One a day. Okay. That was a part.
Maybe I should meet me at work.
I try me. That's it.
I'm said that your friend is saying baby aspirin, aspirin 81 milligram. Ni the same thing. Now dear about na stable in there can say was say your doctors who dry taking a wapa because and you be on my idea be to say Spanish. Spanish. So with this Spanish. It me Emma a friend is saying bleeding vitamin K. And since I would take this Spanish say on my do be a opus would be an woody. At the same time, we'll take aspirin. At the same time, be a will take another anticoagulant. And yes, I would take more a friend is saying anticoagulant. Though Spanish Adriana ye but and also vitamin K. Into say a bit take care drobian and my doctors in whom in no I take even a herbal medications need one blood pressure. It's me my blood pressure costo. A bit me my blood pressure confirm. And as I say, a drobia ye take bia even say a friend is saying herbal a friend is a medicine crana. As I say, my doctors knew say if it's preoccupania of fat a friend is saying and drobi net ye no ma na your doctor nima. Ness or sako prescribing no food be mine. A bit me a high in future. Into the advice I would say a drobia na ye num biano. And I said drobia ye pese ye num biani your doctor who no who say a bell wine at this at that moment now and I say wine. Usually no bia or taking blood pressure medication be usually doctors no almost 2 aspirin so because a go in handy like the way work it together. And a advisable say biara na ye drobia num biani be my doctors and who a dry ye nom send a bear that chibiano enko high with the masipi.
Amen. Omicho obi wa semfufu bi obetime de aba sema. Pacho Mama K, why me too? Professor Kasa Kwanda Hama.
Pacho, mi bisa sam kakra.
Yo, Pacho bra.
My memoir shall see na mi bisa se every Sunday the same time obeba ana obeba so abeboa me obetie bibia na.
Yes, but I am in your invitation now. But I think say a program yes or selected Queen's leadership and a selected your friend saying will be speaker will be to me about each week.
Every Sunday be yes our programming different topics. Every Sunday be 5 o'clock to 6. Yes our programming, but a different topic. The Linda Bessan baby, but all man next Sunday. That's it.
Amen. Yo, opening iPhone be pajaninsa. Menim say why ready a you know akwana afin wakasa. You go to iPhone we pajaninsa. The audience at all. You kwanda mo. Yo, so be any question there, Mamma for Wimbra. Mamma Berenda, what can be fire say, Ebia, see him will be a bit maybe say a suffer man, or my nurses not there, I don't know, said the Baya, and you may be salon between my boy, and I hear whom queer for swear, ye bet me a year near Mafa, and a year advice of the Maya, Jesus, and when he apply. It's not me can say, Mumma in a fun to Yadinimo. Na ene mebi a yentia so na waka yi hunu yi no ye ne ye nurse for na say doctors o mo ya asafo mu no ye ne omudi nkomo na afi no o mamma ye mu ncheche mu se de be ya betimi atiase ende e advice a ma me kan pese na no ye de kwa ya dwemo da mo ase.
That's
Yo, sabele so be ni asem se bia de a ene ma me berenda e mema o kwan na fi no na tot bia obi ano wo de aba na fi no ya bompa na ehio osome so.
Another person with that was say some to me mama a kwanya we ne church ni ni obi abekasa and me so that say for invitation no. So mu hia bibia ampa cho betimi reach out to me.
Pacho the occasion on my antenna can kwanda ho ma papa obeso ke bibia. Pacho kasa yeah it's you.
Patrick, did me email to group chat and it was soon to be our question and I said later on a week or so reaching me and email me over to me. I send him me email man. Yakasa. That's it.
Yo, I'm here to ask. And it's abi no did you medin abawie opening man where the best na maybe I'll bet me a bompire a show or Swiss man where say head the canon. It is a quaint of our bompire shows Miss Maya. That was
I did from Patrol me a pie. The Dimafania Blank said that was an anyway. So a boy and home by Amaya and some day and may and say, can I tea beating the boy a bra? The animal bar lines of the Viviala show, sir. The coastal. I thought I should throw in Sheila tell that the coastal phone should agree. I said, yeah, mammy, I'll be digging a dear to show, sir. Cosune Shirano. Man, I don't any answer no from coastal and church. When you throw an enemy or double kiss to them.